The impact of the coronavirus also putting a strain on healthcare workers and patients. All new, our Jamie Warren speaking with both this evening about the problems they are facing.
He has been down to 15% function since October.
Valley resident Janine says her husband is in need of a kidney transplant. She says their friend who's willing to donate was told by the Mayo Clinic to cancel her evaluation.
Was considered unnecessary at this time and was postponed indefinitely. We were in shock because it was 3 days prior to her flying out.
Mayo announcing all non-emergency surgeries and procedures will be put off for at least 8 weeks as they monitor all aspects of the COVID-19 pandemic. Janine says she's now worried her husband will go into kidney failure, and if he does, he'll more than likely be put on dialysis, potentially putting him more at risk.
That's just very concerning to me.
Her story, one of the many impacts the coronavirus is having on the healthcare system.
There is a very stunning and profound supply shortage.
Sean Murphy, a physician in Tucson, showing off his one and only piece of facial protection.
Each staff member is expected to keep track of their single N95 respirator and to continually reuse it between patients.
He says they usually replace them after each use. By reusing them, their health is now at risk.
There's no alternative, really.
That concern of getting the virus is also seen by Valley nurse Tim Holloway.
They're frustrated, they're stressed, they're tired, they're worried about bringing stuff home to the little ones, to their, spouses.
And a lack of tests means not knowing exactly how far the virus is spreading.
Very few people are going to meet the criteria for swabbing, and you can see the vicious cycle of undetected cases being propagated in the community. I just really hope that it opens our eyes up to be more resilient and prepared as a society to deal with not only this type of outbreak, but similar sort of pandemics and public health emergencies to come.
Jamie Warren, ABC 15 Arizona.
When it comes to patients in need of a transplant, the chair of the Mayo Clinic Transplant Center issuing this statement saying in part they are experiencing extraordinary circumstances at this time, requiring them to evaluate many factors like the acuity of illnesses and hospital resources, adding they are looking at each situation on a case-by-case basis. New visitor restrictions began today at Banner hospitals. The hospitals no longer allowing people to come visit patients. There are 2 exceptions to that no visitor rule. Patients who are under 18 can have an adult with them, and mothers going into labor can have one support person with them. Banner is strongly encouraging people to use phone calls and video chats to stay in touch.